All right, fantastic. Welcome, everyone. I'd like to introduce Karen McMaster, one of our senior therapists here at Bobbi Cook Behaviour Management. And what Karen does during the course of the evening is that she monitors the Q&A. So if you've got a question, Karen will monitor it and she'll pop her hand up anytime during the presentation and ask the question for me, because I get really distracted if I'm focused on the chat box. I can't do both at the same time. So I'd like to start by acknowledging the traditional owners of the land, both past, present and emerging. As proud Aranda woman, this is a very important part of what we do and who we are. So wherever we are in Australia or around the world, we acknowledge traditional owners. I'd like to thank the team of BCBM being on the Zoom tonight. They will be in the chat and be available to you there. So if you've got kind of a general question or a comment, there's team members there that can engage with you. And then Karen will handle the Q&A. Fantastic. All right, let's get cracking on this topic. I've just been advised that some of the professional registration bodies for professionals require there to be an assessment involved in any professional development for them to actually have a professional development opportunity acknowledged. So I'm required to provide 3 questions for you to answer to prove that you've participated fully in the webinar. So the 3 questions are here. And so if that is for you, please just pop the answers to the 3 questions in an email to reception@BCBM with your full name, and we'll send you a certified certificate. Any parents or carers who would like just to have a certificate of attendance for your CV, just flick reception@BCBM an email with your correct name and they'll forward you a certificate of attendance for your own records. Sometimes it's just nice to have what you've done without it actually being certified. All right, what is school refusal? The act of putting more energy into avoiding going to school or engaging academically than it does to do it. So they spend all of their time avoiding going to school. Often it's sick or in pain, headaches and gut issues, a bump on the head, a sore leg, growing pains, a sore back, all of those kinds of things that prevent them from going to school. Peer issues, bullying, I've seen a typo already, from peers or teachers, teacher issues, sometimes it's academic, but do you know what? Often it's just a day ending in Y. It's just too much for them. They don't actually have a better reason for you than that. Factors to consider when assessing the why of school refusal. What's the antecedent? What is the thing that has led to them school refusing? How do we get our head around what that is and where to start? So often there's an underlying disability. So anxiety, pathological demand avoidance syndrome, autism spectrum disorder, ADHD, a communication delay, and I've said anxiety, it's usually anxiety related. Specific learning disabilities like dyslexia, dyspraxia, dysgraphia, and dyscalculia. So let's just unpack those a little bit for a minute, because often kids are very, very good at masking these disabilities. They don't actually know that they have them. So they don't actually say to anyone, I actually can't write, which is what dysgraphia is. But it's more than not being able to write. So what we go, okay, that kid can't write, so let's get them to type. And so we give them a computer and say, oh, they'll be fine now. But in the same way as they can't translate the thoughts from their brain to their hand to write, because it's not a mechanical issue. It's a brain function issue. It's not mechanical. There's nothing wrong with their hand. It's the signal from the brain to the hand getting there with their thoughts ordered to be able to write. That's the issue. It's not mechanical. So we go, okay, they can't write, so we'll get them to type. But that also not only requires a brain signal to get through with all of their thoughts in order to one hand, it actually requires them to get it through to two hands. So then we get confused. Well, we know they can't write, so we'll give them a computer. And then we go, okay, so they can't write and they can't type very well, so let's give them voice to text. So then what they've got to do is they've got to think about the question, comprehend the question, order what they want to say, and then speak it, watch it typing, maybe not exactly what they're trying to say, process that, and produce an accessible outcome, often in a noisy classroom. And we wonder why they can't do it. Now, often these specific learning disorders, when they're in lower primary school, prep and 1 level handwriting is kind of age appropriate until about year 3. But by year 3, their peers are going like this and they're still going like this. So if we think about Luca, my grandson, who I always talk about a lot, he is in year 8 this year and his writing is still at a year 1 level, but he can't type either and he can't do voice to text. So that does everybody's head in, because we all think that dysgraphia is just not being able to write. So there's a whole lot of misinformation around, if a kid can't write, give them a keyboard. If they can't use a keyboard, give them voice to text. It's not actually as simple as that. And then everybody gets frustrated because they don't understand that. When we look at dyscalculia, we often think about that as kids not being able to write and understand numbers and to have a specific learning disorder in maths. It's actually a lot more than that. It's about being able to sequence. It's about being able to do what came first, what was next. It's about larger, smaller. It's about understanding space and geometry. It's about sequencing. So first I need to do this, and then I need to do that, and next I need to do that. That is all part of what dyscalculia is. So we kind of have these stereotypical ideas of what these things look like. And then we think that we're putting supports in place, but often we're having really unrealistic expectations. Kids with dyscalculia can't do time. They often can't read an analog clock, and often they don't understand the passing of time and how long time takes to pass. They can't always process a digital clock. We forget about that with dyslexia as well. We assume that dyslexia is about writing letters, but it's actually also about writing numbers and reversing numbers. And we kind of have this concept that dyslexia is just about number reversal. But actually, for some people who are dyslexic, text moves on the page and they can't focus. But you know what? Those kids don't know it's not normal. And it's not until, because that's what they've always had, that they're getting to year 2 or 3 and they're not actually really making the progress we would expect them to, that people start to ask questions. And it's usually because they're feeling so stressed because they're not able to learn. The wheels start falling off behaviourally because they're trying to communicate their level of distress to us, but they actually don't know what's wrong. So they don't have the words to say, I don't understand why I can't read properly. I can't understand why I can't write. They just get very confused and stressed because they see the expectations on their peers. Hearing and sight impairment can be a huge issue, and both of these things need to be checked regularly. We had no idea that Luca couldn't see until we were down the beach one day, and we were looking out on the horizon, and there were all these huge, huge cargo ships. And we said to Luca, look out there, mate, at all the big cargo ships. And he's like, what? I can't see any ships. And then we realized he actually could not see the ships that we could see very easily. And he has Coke bottle bottom glasses. Like, he was significantly sight impaired, and it hadn't even occurred to us. Because he could watch TV and play his iPad, once we were aware, we then realized he used to sit right up near the TV and he always had his iPad like this. But we hadn't twigged. And it's about that gap between themselves and their peers widening socially and academically. And so for kids who've got any kind of specific learning disability or any kind of disability or impairment of any kind, it's when their peers go up and they kind of keep going flat. The other thing that can be really, really confusing about kids with any learning issues or cognitive issues is often their progress is flat, 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 and we seem like we're not getting anywhere. Then all of a sudden they'll do a developmental leap straight up, and then they'll go along flat, 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 and another developmental leap straight up. And so it's easy for educators and parents to become very frustrated by the flat and shocked by the up. Other students, neurotypical students, are more likely to do this more smooth, predictable trajectory of development. How are we going, Karen? Any questions or comments? Great. All right. A child not wanting to go to school is developmentally appropriate. Oh, I don't want to go to school today. I don't feel well. I don't want to do a maths test. That kind of stuff is kind of normal, and we expect that. And we can kind of jolly them along and say, look, you know, it's only 3 days to the weekend or 3 weeks to the school holidays. Here, have a lunch order, you'll be right. That's kind of appropriate. But then we have the extremes. The child wants to go to school, but they can't go for whatever reason. It's often seen in ODD, ADHD, anxiety disorders, ASD, Down syndrome, and chromosome disorders. It's very much seen in kids with demand avoidance issues. So one of the challenges with task and demand avoidance is it can be very extreme and not actually fit neatly into any of the diagnosable categories that we're familiar with. All right. The main thing I wanted to talk to you about tonight, some of this I did get from Tony Atwood, and some of it from other sources, and some of it just from my experience. Often we don't actually hear what our kids are saying to us when they say, I don't want to go to school, or I'm bored. There's lots of other things that they're actually saying. And if we can unpack that, it can be really, really helpful to know where to go to. So they might just be saying, I'm exhausted. If we think about any kid, any young person who has got any anxiety or additional needs at all, just coping at school is exhausting. So they become physically and emotionally and academically fatigued. And it just is too hard. and they go to school feeling exhausted, and they come home feeling exhausted, and they get so exhausted they stop enjoying their leisure time. So their quality of life goes right down, their happiness factor goes right down, and they have no joy in their life. And that actually leads to depression. So they can become quite depressed. Sometimes they just don't know what to say. They have this kind of feeling of not okay, but they actually can't ascribe a word to how they feel. So they just say, I'm bored, or I don't want to go to school, or I'm not going to go to school. And often they actually don't have language to describe to you what is going on for them. They see the learning that they're required to do as pointless and irrelevant. It just doesn't make sense. I myself remember thinking this about algebra at school. It just didn't make sense to me. I could never make sense of numbers. I remember when I went to uni, I had to do a maths unit, and I went into the maths class and they said, okay, we're just going to do a basic maths quiz just to get everybody's brains warmed up. And the question was 9 minus 3. And I burst into tears and ran out of the classroom because I was like, I have got no idea as an adult what 9 minus 3 means or what the value of that is. So if as an adult I felt like that, a child who's got a specific learning disorder or has been unwell, has had like medical issues going on and they've missed lots of school, or they've had behavioural issues in primary school, so they've missed lots of chunks, and they get to high school, they've missed a lot, but they don't actually understand what they've missed. They just don't know what they don't know. And then when they're confronted with that and everybody else goes, yeah, I know how to do that, they experience deep, deep shame. And that's a horrible thing for them to experience. I cannot understand what the teacher is saying to me. Often teachers pile on with instructions. So they say, okay, everybody, I want you to get your maths books out. Okay, so get your textbooks out, and I want you to open to a clean page. Hurry up, everybody, get your books ready to go. I want you to rule up a standard maths page for me. And can everybody down the back please get your books out and ready to go? And so what there's actually been is 8 different instructions in 30 seconds. And they're still trying to remember what the first instruction was and do that, let alone process all the other ones. So then they're so overwhelmed by trying to understand the first instruction that once the teacher goes on to actually presenting the starting material and kind of that thesis sentence and setting the success criteria and the outcomes for the day, they're still trying to remember whether they've got to rule their page or not. So then they actually can't process and understand what the teacher is saying. So then they're likely to use dissociative behaviours to try and cope. How are we going, Kez?
Going well.
Okay, great.
About 9 minus 3.
Sorry?
I'm still trying to figure out 9 minus 3.
I don't know. But I think a minus and a minus makes a positive, but I don't know whether it's a positive 6 or it's a positive 12. I have no idea. I'm just really traumatized by that, obviously, and haven't worked it through. I might need to catch up with you about that, I think, Karen.
I've just Googled it, but I've got no kind of internet happening on my phone. So, yeah.
Oh, well, somebody will put it in chat. There'll be a maths genius out there going, how do you not know that?
I know.
I reckon Bill would know the answer to that. I'm bored or I don't want to go to school makes me sound cool. It's kind of what the cool kids say, oh, yeah, I'm not coming to school. I'm not coming to sports carnival. I don't have to do that. So they don't know what to say, so they pick up on language that they think is appropriate. I'm being treated like an idiot. So sometimes teachers can actually treat our young people like idiots because they don't actually understand what's going on for them. A lot of kids with additional needs are actually very clever in some areas, and they can actually have crazy high IQs, and the work that is being presented is just too easy for them. A lot of kids will go, actually, I did that in year 7 and I've already proved I can do it. I actually don't need to produce an accessible outcome. We actually had this with Luca the other day. So he's in year 8. In year 7, they did basic hand sewing stitches in their sewing class. And this term, he's got an elective of sewing again, and their new sewing teacher actually asked them to do exactly the same activity that they did at the start of year 7. And Luca kicked up and he refused to do it. He said, this is too easy. I already know how to do this. I was told we're going to be doing sewing on sewing machines, and this is what I want to do. And we had a huge hoo-ha over that. But what was presented to him was too easy. It wasn't given context. He wasn't given the progression of what they were doing. There was no acknowledgement that, yes, you have done this in year 7, but I just want to see where you're up to now, or this is the progress that we're going through. It wasn't communicated in a way that he could understand.
Jennifer's just made the comment that her son's already at capacity before he arrives at school, and he can be easily misunderstood.
Yes, absolutely. That's right. Yeah. So it actually takes all of their energy to get to school. And Jennifer, that's absolutely correct. Your young man is already at emotional capacity before he even gets to school. So the school says, we don't understand it. He arrives at school, he looks calm, he's compliant, he comes into class and sits down, and then the next thing we know, he's losing the plot, but there's no antecedent. We can't see why that happened. So he is going from, they think he's going from 0 to not being able to cope like that. The reality is that he's arrived at school at 99 and he's hit his limit by 9:05. And if there's a CRT that he's not expecting, he's basically walking into the classroom, seeing a CRT, turning around and walking out. And whether he does that physically or emotionally, that's exactly what he does. So I'm going to talk about Luca again. We actually have an agreement with the school that if there's a CRT, he doesn't go to class.
Just a question, what's the CRT has come up?
Yeah, for sure. It's a casual relief teacher. So that's a term that's used in Ballarat. I don't know about anywhere else. So I'm very sorry for using an acronym like that. I'll try to be really mindful of that. So Luca can actually cope with the casual relief teacher. No worries. He actually doesn't have a problem with them. What he has a problem with is all of the other students' anxiety and their heightened behaviour, because they're not confident that the casual relief teacher can keep them safe and educate them and hold the space for them. And they play up and they test the teacher. Luca cannot cope with that. He becomes incredibly anxious. He becomes a little social justice minister and a social justice police person, and he tries to make everybody behave. And then he starts yelling at his peers, and then that actually sets up that whole Luca's unpredictable, he's not safe. And then they start teasing him and baiting him, and it goes to hell in a handbasket. So we have determined that for Luca's well-being, to be in a classroom when there's not the normal teacher isn't helpful. So we've had to set up an alternative program.
Yeah, Aisha's made the comment too that she's come to understand her daughter's anxiety and the demand avoidance, and she freaks out when there's something coming up at school, so she usually lets her stay at home, and this meant that she can go more of the time, and anything over 50% has been a win for them.
Yes. Yeah, so adjusting your expectation. Yeah. We often find that kids who are doing school refusal are also doing help refusal. So they don't want to go to the doctor, they don't want to go to a psychologist or a pediatrician or a counsellor or a youth worker. So they actually become school and therapy refusing at the same time, because often there are demands placed on them. So if teachers and if educators or therapists are uninspiring or aren't respectful, then they will refuse both of those things. Being spoken to like a child and being spoken down to really won't work. Often they think they have better and more meaningful things to do with their time. And they have tasks that they require themselves to do, and that can be overwhelming. They're feeling sad, depressed, lonely, or I don't know how I feel, and they're overwhelmed by that. They don't actually have the interoceptive awareness to be able to explain what's happening in their body. So when we're talking about interoceptive awareness, we're talking about the understanding of what feelings mean in your body. So they may have a sensation in their stomach that is uncomfortable for them, but they can't actually identify whether that is anxiety, excitement, hunger, thirst, needing to go to the bathroom, or whether they're going to throw up in 2 minutes. So often anxiety impairs interoceptive awareness, and they're not actually able to read what's happening in their body, and they're not able to read or give names to their emotions or feelings, and they become overwhelmed. Often interrupt shouldn't be there.
Just a question, Bobbi. So can these kids still stay in mainstream classes? My child is being pushed to a special education unit.
I think that's a real individual thing. I think it depends on their IQ. I think it depends on the resources that are available within your setting. Are you in the city? Are you rural? Are you remote? What additional services do the schools in your area have available? I think it's about moving them forward 1%. And keeping them moving forward. I'm going to talk about in a few slides the issue of praise and being really excited when we get them to school and the impact that has, and the demands that we place on them without understanding that. I was talking to a mum yesterday whose son hasn't had a shower for 3 years.
Yeah.
And she's just despairing about, how can I see a change to that if I can't actually let him go out of the house because he's just filthy. I can't even let him go out of the house. Not that he wants to, but what do we do with that? So what happens is we get our kids get stuck in a poverty of imagination. So where their imagination to imagine a different future becomes impoverished. So our goal is actually to reduce that poverty of imagination so that they can begin to imagine a different future. I've got a young woman that I'm working with, and she finds showering incredibly difficult. So I'm changing up what we're doing with her and looking at 1% improvements. So I've actually said to her, I do not want you to have a shower. Having a shower is off the table. What I want you to do, if you possibly can, could you just wash your hands this week once? So really peeling back the demand, right, like a long way back from where we want to be. But even if I can get her to wash her hands once this week, there's a crack into opening her imagination to what it might be like in the future if she could wash her hands every day. So opening that doorway to a different way of seeing the future.
Yeah.
And changing our thinking from this is where I want to be, and I've got to jump to here. We've got to have this is where we want to be, but we've actually got to peel back our expectations to these tiny incremental 1% improvements. Because do you know what? It's 1% between 99 and 100. So we miss the impact of those 1% because as they add up over time, if we move a child forward 1% a month for 12 months, they've actually moved forward 12%. And if we can do that over 5 years or 10 years, we've actually moved them forward 100%. So I'm just being really challenged as a therapist to reconsider my framework and my thinking around this.
Bobbi, there's just a couple of other comments.
Yeah.
Jennifer's saying sometimes it's whether the teacher is willing to understand and make some compromises in the classroom.
Mm-hmm.
And she's saying we're lucky to have a great teacher who's created a safe and understanding place in primary school. And then there's some comments about expectations and adjusting them. It was a challenge to adjust my expectations and not wanting to do that with my neurotypical child. And someone else then made the comment that, actually it was still Aisha, that he sees his sister going and then it becomes a challenge to manage that.
Yes.
As well.
It really, really is. The injustice of it within a family is huge. It's very, very difficult. And I'll when I stop sharing in a minute, I'll just draw you a diagram, which some of you will have seen before, to help you to be able to explain that, the injustice to your children.
Yeah, and Bobbi, there was just one more trigger that someone suggested.
Oh, yes.
A friendship breakdown can trigger.
Yeah, yep, that's great. I'm just going to write that down and I'll add it on. Well done. And look, there are as many issues that lead to school refusal as there are kids.
Yeah.
So let's go on. Nope. Don't want that slide, sorry. Okay. It is frightening and stressful to be unable to go to school. Okay, it's not that they won't, it's that they can't. And they experience going to school as a life-threatening event. And what they then experience is the people who love them and say they're going to keep them safe, parents and educators force them to go into a situation every day where they're not safe and they can't cope. And that's their experience. Now, we want them to have a good education so they can get a good job and have an amazing future. And we actually know that they have the ability to do things. They have the ability to learn. And as I always harp on about, what it is they actually have abilities. So we know that they can get up and get dressed and they can go to school and they can do a whole day of school if they choose to, but it's actually not a choice. So they have the ability to do that, and we know that. But what's variable is their capacity emotionally to access that ability. So like what Jennifer was saying before, is that just getting organised for school uses most of her young person's capacity emotionally for the day. And just going to school actually uses all of that capacity, so then they're not actually able to access their ability. So some of the things that go through kids who can't go to school's head are, I'm terrified, fear of what their peers think, what will their teachers think, am I okay? Will I ever be different from this? Will I ever get a job? What's wrong with me? I'm terrified. Is it, I can't actually see a different way. I don't have hope. I am despairing. And then when our kids get to, I don't have hope and I'm despairing, that is a very serious point in depression. And that's when they go to places in their heads that we really don't want them to go, and that terrify all of us.
Yeah. Yeah. I think there's lots of fear, isn't there, for the parents? Aisha makes a comment that I must say that my child's school refusal and anxiety has made me wonder how she would cope with the workplace.
Yeah.
Honest.
And I was actually talking to a parent this afternoon who was saying that their young person who's been school refusing for years actually wants to get a job. And she walked into Supre the other day with a resume that she had done with her mental health OT and asked if they were hiring. And mum was just flummoxed and floored and couldn't understand how her child cannot go to school but could pull it together enough to go and apply for a job. And she's also applied for a job at McDonald's and Hungry Jack's. And just couldn't understand how they could do that but not go to school. One of the things about any of those roles is that they're scripted roles. So if we think about a job at Macca's, for example, it's scripted. You're trained. There is a procedure for everything. You put on your uniform and you become a McDonald's crew member or a trainee crew member. You are not yourself. You may not even have your own name tag on. And I know a lot of the Macca's kids actually don't wear their own name at Macca's. They wear a different name and they put on a different persona. And they start in the dining room wiping down tables. And they're told, this is how you fold your cloth. You fold it this way and then this way. You put your hand on it like this. You start at the top right-hand side of the table and you wipe from left to right all down the table. And you're assessed on that. And then you're told, yes, you've passed wiping down tables. And the whole process is scripted. And so they find that very reassuring. Supre is a bit the same, and a Hungry Jack's is definitely the same. So she can go into those situations and fulfill a role where it's very clearly defined and success is easy to attain. School, it's very unpredictable.
Yeah.
You don't know what's required of you. It's different in every class. You don't have a script to follow, and it's not the same every time you go there.
Yeah.
So it's really overwhelming. So how do we look at supports? Work with a school if you can. because you can't always. Because one of the things that our school refusers do is that when they actually get to school and they manage to get there, they actually hold it together and they respond appropriately to their peers, and they're in class and everybody goes, yay, fantastic to see you. And then you might not get them back there again for 6 months. And so schools often find that very difficult to understand. Insist student engagement officers get involved. Find a good therapist for them and you. You having support whilst your child is school refusing is critical, because you are going to come under judgment from educators, professionals, family members, your friends. They are all going to place judgments on you, often out of the best of intention, but you are going to feel the weight of that, and you need support to process that. Access Carer Gateway, it's federally funded. You can get a minimum of 6 support sessions for you as a carer. It's a bit of a process, but it's actually worth doing. Join Facebook communities. The Pathological Demand Avoidance Syndrome parent Facebook community in Australia is amazing, and it talks about all of this demand avoidant behaviour and school refusal behaviour, and is an amazing resource to you.
It's just a comment, Bobbi. It's so hard to find a good therapist or therapist at all that understands PDA right now. All say that their books are closed.
Yeah, I know. It's really hard. I get that. It is really, really hard. And that's actually the reason that we offer a free webinar, just as a bit of a resource. And I'm sorry that we can't do more, but I hope at least gives you a few ideas and strategies. We do have a little bit of capacity in our practice at the moment. I've just put on 4 new therapists in the last couple of weeks. So we do have a little bit of capacity. The other thing is I am stepping back from working with kids to be able to manage the practice, because we actually have 26 staff members now. And so I will be offering the single session and 3 session intensives for parents. So that is a possibility. So in a single session intensive, we look at your child's situation. I make lots of recommendations. They're typed up for you to go ahead with. In a 3 session intensive, we go into a few more actual individualized strategies. You get to try to implement them. I can do a school meeting and an NDIS recommendation report within that.
Yeah.
So there are a few options there that we can help with, and we are looking for more staff, because this PDA school refusal extreme anxiety space is fraught.
Yeah. And you also meet with the whole family too, don't you, as part of those intensives?
Yes, the 3 session intensive, that's right. Yeah. What's also really, really important to remember with Carer Gateway, if you've got a child who's school refusing or has PDA or any other disability or impairment, the siblings can access support through Carer Gateway. So they too can get 6 sessions of support as young carers. In Victoria, New South Wales and Queensland, Little Dreamers offers young carer support. I'm sorry I'm not up with what's happening in the other states at the moment, but I can certainly find out and let you know if you want to flick an email through.
Yeah, Wendy was just asking if they can be done by Zoom.
Yes, absolutely. Yes. Yes, Zoom is fine. I am now the Zoom queen. And where our practice is now ready, say, for example, if we were to go into a lockdown tomorrow, we would still continue with all of our appointments. They would just all be rescheduled to Zoom.
Aisha's just got a link on there in the chat. which is very helpful. Thanks, Aisha. For
Yeah,
this.
is that to the PDA Facebook Australia?
Oh, I'm sorry, that's for the 1 to 3 session.
Oh, the 1 to 3 sessions. Thanks, Aish. Aisha, could you also put the link to the parents PDA? Great.
Working on that now.
Oh, legend.
There's just a comment from Joanna. My 15-year-old son has started a new vocational school this year. I've tried to explain to the coordinators about PDA and even offered to supply information about it, but they weren't very receptive.
Yep. It's just so frustrating. It does my head in, and I can only imagine what it does to your head. Look, one of the really big problems is that our schools are all set up with academic curriculums and not functional curriculums. And so I'm having lots of big discussions and fights with schools at the moment because we've got this cohort of kids who, if you've got an IQ of 69 in Victoria, I'm not sure what it is in other places, you can have access to funding for additional support, or you can have access to a specialist school. If you've got severe behaviour in Victoria's mainstream schools, you can access some support through severe behaviour. In a mainstream school in Victoria, if you've got autism or anxiety, it's very, very difficult to access any support in a mainstream school. If you've got an IQ between 70 and 85, there is no support for you in mainstream. If you've got a specific learning disorder, sometimes you can get aid support, but not so much. It's a really, really difficult space. One of my big arguments with schools is that they modify work, but they don't differentiate, because many, many teachers don't understand the difference between modifying and differentiating. So say if they've got a child, and I see them do this a lot in primary school, say a child can't manage 10 words in their writing out their spelling words. They don't go, okay, you can do 3 words. Here, I'm just putting 3 words on a page for you. You just have to write out 3 words because that's what your capacity is. They actually give them the sheet with 10 words on it and say you only have to do 3. Then they are faced with their failure and their shame. And they actually have to look at their lack of capacity and ability in the face every single time they do spelling every single day. So rather than be faced with success, with only having 3 words on their sheet and then successfully completing the task, they have a sense every day that they're not enough. So that is modification, not differentiation. And I think that is the basis for a lot of our kids of where they develop school refusal. So it actually starts in those early years where work is modified and not differentiated.
It's really tough, isn't it? We've got a few more comments.
Yeah.
Wendy said that there's also on Facebook a school can't group, which is very good.
Fantastic.
Jody suggested asking the paediatrician to send the booklet to school. If it comes from the doctor, they tend to listen better.
Yeah.
There's Jody also had another one with the link for Tara is a great resource group for people looking to find a person about PDA.
Oh, fantastic.
Megan made the comment, my son's school refused special school due to needs not being met.
Yes.
Local mainstream don't want him. Can't be homeschooling with dyslexia specific program. One school says I'll take him, but avoid me when I mention about dyslexia specific help.
Yeah. Yeah. One of the things that we're finding is making a difference is in a lot of our reports, we make recommendations. We have now changed that from recommendation to requirement. So rather than it is recommended that Luca have one-on-one support whenever he is in the playground in a dysregulated group of young people, we now say it is a requirement for Luca to have one-on-one support to be able to access the playground, and the change is immediate. So actually talking with your therapists and your pediatrician and saying, could you please say it is a requirement that my child have the NDIS. It is a requirement that this child has access to one-on-one support. It is a requirement that this child have a differentiated curriculum. And just shift the narrative that we're presenting. But you've got to really put your grown-up undies on and be really brave. And it's really, really hard because often we're already carrying the weight of that judgment from educators and just from society. And I carry a sense of failure around Luca's education. So my grandson, who I'm caring for, at the moment, after working really hard to get him up to full-time school, we've just had to drop him back to part-time school again because the school isn't actually able to meet his needs at the moment. And it's really, really frustrating. So we're working with the school to develop a functional curriculum for him. So if I can't get Luca to school full-time, please don't feel bad because I actually know the system and I have the relationships, really good relationships within the school, but the school system just isn't equipped to meet his needs. And it sucks and it's really, really hard.
Yep.
And I know the system and I know how to do it and I still can't get it right.
Yep. And a phone call from the school makes you nervous, understandably.
Oh, I actually still have phone anxiety. Like I look at the school number and I kind of have a PTSD response. And so I don't think that's unusual. I see a private number pop up and go, oh my goodness, it's either the NDIS or it's a school. And neither of them I particularly want to speak to some days. All right, I'm mindful of the time. I just want to go through one more slide with you that I think is really, really important. Praise the implied demand and working with people around this because we can just lose ground very quickly. Okay, so day one, you ask your child to go to school, they manage their anxiety and they comply. You're thrilled that they've actually gone to school. You praise the child, they freeze and explode and you settle them. So it's the same thing with going to school. You actually get them to school, everybody's really excited that they're there and they praise them. Oh, it's wonderful that you're here. We knew you could do it. Looking forward to seeing you tomorrow. Day two, you say, okay, great job yesterday. Let's go to school again today. The child's anxiety erupts. They refuse to go to school. You re-request and you remind them of their amazing success and they melt down. They shut down. They refuse to go to school. Then you bribe and you encourage and you push and you bully and you yell and you skink and you cry because your anxiety is absolutely triggered. And you go, oh my goodness, oh, I can't do this again. Oh, we've worked so hard to get to this point and now it just, you know. Your child may become angry or violent if they're at home or in a safe place. If in public, they may even smile sweetly. and then the child refuses to do that activity again, and it may take 6 to 12 months to get them to actually be in a point where they can actually try school again. So actually really working with the school, yourself, and family members around not making a big fuss, not using the implied demand of praise when they start to make progress. Because what happens is we see a lot of young people refusing to take medication, because when they take medication, they actually can do a few things more successfully. So they might be able to get to school, and it starts to build this ongoing expectation that they can keep doing it, but they actually find they can't. So they actually stop taking the medication so that their anxiety is worse and they're more unwell, so that you then can't force them to go to school. So we put them on medication, and that then actually increases the demand on them. So it's managing through that. And I know, look, that's possibly not the most amazing note to end on, but it is a note that actually describes how difficult this is for you. There is no magic bullet, there's no magic wand, there's no miracle basket, but just for you to know that it is not about your competency as a parent or even a therapist or an educator. That is not what this is about. It's actually a really serious medical situation that requires a multidisciplinary team who understands school refusal, demand avoidance, and extreme anxiety to move to the next spot. What I do hope is that you can open your imagination a little bit to see some hope and have a place to start that might have been different from before. So once again, this is the professional learning information. Kez, I'm happy to stay on for a few more minutes if people have got questions.
Okay, yeah. They love the difference, stating the difference of the wordings and recommendation to requirement. Brilliant, says Kelly.
Yeah.
The PED says that PDA is just a label, or it's just ODD.
Yes.
Defiance disorder.
Yeah. And look, that is the Australian stance, and that is the stance particularly of a couple of the paediatricians in Ballarat at the moment. And I don't think PDA is ever going to end up in the DSM-6. I don't actually think it will be ever a standalone diagnosis in Australia. It is in the UK, and maybe in time it will be recognised. I almost agree with them around PDA being ODD, except for the level of anxiety that we see. So with ODD, there is no guise of trying to present on the outside that you're actually okay. There is no masking, there is no trying to comply publicly. Whereas often in PDA, there is an internal drive to be normal. And that's why it's often masked for quite a long time. And you'll have the big meltdowns at home, and you'll have the compliant, perfect child at school, and parents saying to paediatricians, my kid is a nutter and things are going crazy and we're not coping. And then a school saying, oh no, we have no problems at school. It must be the parenting. I actually had a situation today where a parent was just heartbroken because they had a psychologist that had said, yes, absolutely, your child meets the criteria for an autism diagnosis. And then they did the school interview, and the school said, we don't see any indicators of autism at all in this child.
We're getting some comments. Okay, so I've been told that ODD is anxiety coming from the ADHD neurology, whereas PDA is the anxiety response from autistic neurology.
Yep, I would agree with that. That's a great way to put it. I've never heard it put like that. I love that. Thank you so much.
That's from Jody. Thanks, Jody.
Jody, like gold star to you.
We probably need to copy that, don't we?
Yeah, we do.
PDA feels different to me than ODD from Aisha. My child wants to appear normal and was perfect at primary school and then would destroy our house. It was crazy and no one would believe me. Okay, and there's just some questions from Wendy. I love your explanation of implied demand if praise. Any quick tips to avoid the implied demand of praise? Just keep it cool. Is that the question mark?
Yeah, so it's just if they do something, you know, that you're wanting them to do, good, like very not a big yay, just okay, good. And if they do something that you would just normally expect a child to do, like get up and get dressed in the morning or actually have a shower, just nothing. So because with a neurotypical child, you don't have a song and dance if they have a shower. You don't have a song and dance if they go to school. So it's just like, okay, I'm going to go to school today, Mum. Oh yeah, rightio. Can I make your lunch for you? Oh, I can't go to school today. Okay, can I make your lunch for you? So that your response to them going to school or not going to school is actually safe and predictable for them. Inside, you can be going, oh my God, I can't do this again. Or yes. And when they go to school, you can ring every man and his dog that you know and go, yes, they went to school. But just even when they get home, no demand, no praise. Like you can say, oh, how was school? And they go, oh, yeah, it was all right. Good. Don't just a normal, unexcited response so that they don't feel that demand and that pressure. And if they get up the next day and they go, I actually can't go to school today, it's just, oh, okay. And inside you'll just be dying. But it just creates that safe space for them to actually be able to process that.
Yeah, I've just got a comment, which is probably one that's good to finish on. Sometimes I forget how far we've come because we still have so far to go. It's good that you've reminded us to appreciate the baby steps. Thank you.
You're welcome. Thank you so much, everyone, for coming. I'm mindful of the time. I really do try to stick to the hour.
Sorry.
Oh,
there's one
no
more.
worries.
One more. Sorry.
Yes,
so
that's
if
okay.
a child is refusing to go to school, we shouldn't encourage them to go at all?
Oh, no, you always give them the opportunity to attend in a way that works for them. So I can't go to school. I'm not going to school. I get that that's how you're feeling. Is there anything I can do that can help you to get to school today? No, I can't go to school. Okay, that's all right. Go and rest, and I'll come and talk to you about it later. Let them de-escalate and then go and have a conversation about what they need for school to be safe for them. And if they say, I don't know, say that's okay. I'm going to come back to you with some things that I think might be helpful later, and then come back with one suggestion for them. So can we just go down the street? Can we go for a drive-by school? Would you like to do a chat with one of your mates from school? Just so that they're staying engaged with school. But please don't put crazy pressure on them, because it's just that sense of school not being safe, and then you as their safe person, but forcing them into that life-threatening situation. If they didn't feel overwhelmed, they would go to school like every other kid goes to school, because school's actually pretty safe and okay. If they're school refusing, it's because school's not safe, and we actually don't want to force them into an unsafe situation. We want to understand what's not safe and what's not okay for them before we really start pushing.
Takes a lot of courage, doesn't it, to hold that?
Oh, it is really, really hard, and that's why getting the support of other parents, if you can't get the support of other professionals.
Yeah.
I want to talk about something else. They often make crazy demands on us emotionally, and they will try and bargain with us. Often there's lots of demands around food and the kinds of food they want to eat and what they will and won't eat, to try and control situations. They'll also ask for clothes, they'll ask for food, they'll ask for social media access, they'll need access to games, and managing all of this can be really, really difficult, but it all goes hand in hand. And often the media obsession and the game obsession that we see when kids don't go to school is because it's a space where they can be successful. And having that conversation with them about, I have noticed that you relate really well on online gaming and you are really successful in gaming, and I'm so thrilled to see that you have a space that you're really, really successful. Can we work together to look at how we can transfer some of that amazing success that you have there out into your everyday world? And can we try and find somebody who can help us translate or move your success there into the real world, or into a different part of your world, not the real world, because their gaming world and their success there is very, very real to them. And that will actually build a bridge of understanding between you and your child in a way that you would never imagine it would, because you're actually acknowledging their competence in that space and you're seeing them as competent, because their story that they have about you is that you see them as incompetent.
Yeah, Bobbi, it's just such a huge leap, isn't it, for parents to, it's a lot of, I would imagine there'd be so much grief around that.
Oh, it's horrific.
Yeah, terrible.
Terrible.
Wendy's just got a question at the end of this. Gaming during school hours.
Oh, yep. That is such a tricky one, isn't it?
Yeah.
And look, I vacillate around that. And it actually depends on the child and the young person and the situation and how unwell they are and how far they are down the school refusal pathway. So with some kids, we actually put in a special router. So during school hours, all they can access is Epic Books and Mathletics. So they can still have access to the computer and they can still dissociate from the difficultness of their situation, but they're losing themselves in maths or or in Epic Books. So you lock down the device to just a couple of websites or a couple of apps that mean that you're acknowledging their need to be online and have access to technology, but you're putting boundaries around it. And so if I was going to do a lockdown of technology and gaming during school hours, I would allow access to some academic online stuff. So there are a few specific routers that you can get that can help you with that, or you can actually use the Microsoft and Apple tools to be able to do that. If you would like more information about how to go about that, on what some of the devices are that you can use to actually lock down your internet and devices in that way, just flick us an email and I'll send you the information on how to do that. And what's good about some of these devices, we often get stressed because if we don't want to have our kids have access to the internet during the day, we have to totally lock everything down and we can't have internet access, but that's not actually true. You can lock certain devices down on a router so they can't have internet access or have limited access, and you can still have full internet access, and so can other members in the family.
Oh, and I feel like we need a part B to this. Can PDA be related to trauma history?
Which came first, the chicken or the egg? If we line up a lot of the indicators for trauma, ADHD, ODD, PDA, autism, anxiety, and if we line up all the indicators, there's so many similarities. It really is honestly very difficult to pull them apart. I think if there is a genetic predisposition already existing, trauma intensifies the indicators that we see and the behaviors that we see. And the reason the trauma increases the intensity of the presentation is because the predisposition means that the young person is unable to process the trauma in a neurotypical way, and therefore the trauma appears to have a more severe impact. Because their cognitive processing and the way that they process trauma and the way that they're likely to obsess or railway track about something is much more significant. So the trauma impacts the neurotypical child and the child with a predisposition towards anxiety, PDA, anxiety, ODD, autism. The impact is the same, but the way they can actually process that experience is different. I was having a conversation with a mum today about, will the NDIS acknowledge trauma, and can we get the NDIS for trauma? The short answer is no, but if your child has a recognised disability, you can get additional funding in your NDIS plan to support your child to process trauma. And so that can actually be a helpful distinction.
Well done, Bobbi. That was really good. It's now it's 16 minutes past 9.
So we really need to go, don't we?
We do.
All right. Look, thank you everybody so much for coming on tonight. We have got 97 people online at the moment. So thank you so much for coming, and I hope we've been able to be helpful, and we will look forward to seeing you next time. Aisha, I can't actually remember what our next topic is.
Oh, it's a juicy one, slightly scary. Problem sexualized behaviour, and it's on the 3rd of June. So
this might apply to some people on this call, maybe not. I've set up the registration page on the website, so I'll pop in the link before we end here.
Thank you. So yes, that's something that comes up all the time. I'm a little bit anxious about talking about that, but I run towards issues, not away from them. So it will be challenging. It will be an explicit topic, but let's run into it and we'll have a good crack at it. So thank you, everyone, and have a great evening. Good night.
Right.
No, it's actually more than 9.